diseases are spreading very fast in India, and when it comes to the marginalized section, they are the ultimate sufferers of non-communicable disease. Hello and welcome to the InFocus series of Drishti IAS. I am Ritu and today's session is about health burden of non-communicable disease on Indian cities, and this session is important for your GAS 3 perspective. Moving towards the points of discussion part. So first of all, we are going to discuss the news, then we'll have a discussion on brief introduction of non-communicable disease, then how it is becoming the health burden, then we are briefly going to discuss about the policies and technologies, and then practice question for prelims. Before that, you have to like, share and subscribe to this TIAS channel. Moving towards the news part. So before moving to the news part, I want to make an important announcement for you. Drishti IAS Mukherjee Nagar branches has been shifted to the Noida, and our new address is C171/2 Block A, Sector 15, Noida, Uttar Pradesh, and nearest metro station is Noida Sector 15. This is the calling number 9311406440, and the Hindi medium class will start by 9th of December 3 PM, English medium 12th December 6 PM, and this is of the Sambhav. So Sambhav 2025 will benefit in your prelims examination, in your mains examination. So if you want to prepare for your prelims and mains, do check the Sambhav 2025. Now we'll come to the discussion part. So discussion is that in Bengaluru, a bus driver died due to the cardiac arrest while on duty, and this sparked a debate on the death toll and the burden of non-communicable disease in urban India. So this news which we are going to cover up, that what is a non-communicable disease and how it is becoming a health burden. So coming to the introduction part of the non-communicable disease. So non-communicable disease, as the name suggests, that it could not be spread from one person to another person. So what is it? So it is a chronic disease which lasts for the very long time, such as diabetes, cardiac problems, heart issues, stroke issues, and tend to be for the long duration, and it is a combination of, it occurs due to the combination of physiological, environmental and behavioral factors. And what are the examples? So examples are the heart attacks, strokes, cancers, chronic respiratory disease, and these are the diabetes, asthma. These are the types of the non-communicable disease. And low middle income countries. So middle income countries, low middle income countries are the ultimate sufferers of non-communicable disease, and we can see that around 31.4 million death occurs in low middle income countries because of the non-communicable disease. Now we'll come to the overview of the non-communicable disease. So according to the non-communicable disease, what we have seen that it kills around 41 million people each year, equivalent to 74% of the deaths globally, and each year 17 million people die from the NCD before the age of 70. 86% of their premature deaths in low and middle income countries, 77% are in low middle income countries. Of all the deaths, 77% are in the low middle income countries. Then cardiovascular disease account for the most deaths, and it accounts 17.9 million people annually, followed by the cancers 9.3 million. Then we have chronic respiratory disease 4.1 million, and diabetes 2 million, including kidney disease deaths caused by the diabetes. And these four groups accounts over 80% of overall premature NCD deaths because of the cancer, because of the cardiovascular disease, because of the diabetes, because of the respiratory disease. Around 80% of the overall non-communicable disease people died, and especially in the low middle income countries. And tobacco use, physical inactivity, harmful use of alcohol, unhealthy diet patterns are the contributing factor for non-communicable disease. And what it's the preventive measures, so early detection, screening, treatment of NCD as well as palliative care are key components of the response to NCDs. So why these data are important? You need not to remember each and every data, but you should have a overview and aggregate idea about that low middle income countries are the ultimate sufferers. It is the cardiovascular disease which is contributing a lot to the deaths. Then you have to also think about the cancer deaths, diabetes death, respiratory related problems. So these are the main what you can say disease which is taking people's lives. So overall, what is the outcome of the slides? That it is affecting the low middle income countries. These are the 4 diseases: cardiovascular disease, cancer, chronic respiratory disease, kidney disease, diabetes are 4 most important diseases which occurring most of the deaths, and this shows that non-communicable disease should be taken care. If there will be the early detection, if there will be the early screening, we can prevent such kind of a disease. Now we'll come to the what you can say challenges in policy implementation and urban health. So here we can see that overview of what is it is happening into the urban health and what are the contributing factors, how migration is responsible. So over half of the world's population living in urban areas, this figure projected to reach by 70% by 2050. So this time in world around 50% living in urban India, but it has been expected that due to rapid urbanization, the number and percentage will reach by 70% by 2050. So in another 25 years, we are going to reach by 70%. And India's workforce is characterized by significant interstate migration. So as you already know that people from Uttar Pradesh, Bihar migrate to the cities, people from the rural India migrate to the cities, and people from different states migrate to the different state for in the search of job, in the search of livelihood. So India's workforce depends upon the interstate migration, and with approximately 41 million people moving between the states. So this is the census 2011 data. It has changed, but we do not have any recent data for now. And what we can see that it constitutes around 29% of the total migration rate according to the periodic labor force survey. And what we can see that around, suppose that 100% people are living into the urban areas, and out of 100%, 49% lives in the slum areas, and that becomes very much vulnerable to caught such kind of the diseases. Now we'll come to the next one, which is about the health burden in urban India. So there are 3 kinds of the problems which creates health burden in urban India. So hazardous work environment. So as you already know that most of the, we can see the data that 49% people are living into the slums. So they have a very hazardous working condition. Most of them work on a daily wage laborers, construction site workers, factory workers. So they have a very hazardous health condition, and that became them very prone to the non-communicable disease. Then they have also limited access to the healthcare. So whenever you go to the AIIMS, Safdarjung or any government hospitals, what you can see, there is a long queue, and that becomes a very biggest obstacles in accessing any kind of health facilities, because there is a very less doctor per population. So this is a very problematic situation that healthcare is not easily accessible. And then financial vulnerability, because most of them belongs to a low income group and they have to survive, they have to earn for their livelihood, they have to send money to their home. So it creates extra burden on their pockets, and that is called as out of pocket budget. So that is what you can say double what you can say slap on them. At one point of time they are earning very hard to run their daily lives, and on the other hand, if they caught any disease, they had to also burn out the expense of all those diseases. So that's why these are the 3 factors which is contributing to the non-communicable disease. Then here we come to the key national health trends. So what we can see that the recent data has shows that there is a reduction in tobacco use and rising lifestyle diseases. So because of the urban lifestyle, because of the poor living condition, because of the deteriorating standard of living, we can see there is a situation of hypertension, and that causes diabetes, that causes obesity. So these are also problems which is rising and which is contributing into the non-communicable disease. Then we have the burden of non-communicable disease. So silent progression. So what we can see that we do not have any early screening mechanism until it reached to the advanced stage. Then we got to know that we have got such kind of the problem. So most of the non-communicable disease does not show their signs and symptoms. So this is also one of the problem. Then economic impact, we had already discussed about the out-of-pocket budgets, because they are already struggling with their daily expenses, and in that situation, if they caught with any disease, so they do not have money to afford such kind of the situation and such kind of the medicines, test, doctor's fees. Then social determination of the health. So factors like workplace condition, housing, community ties, migration status, and these are the things we already know, that because people are migrating from rural areas to urban areas, and they are mostly living in slum areas. They do not have proper drinking facility. They miss their community ties because they are coming to the cities and they belong to a certain environment. So that also creates a problem to them. And also what you can say, environmental problem of the cities. We can see the Delhi and most of the cities have a very poor AQI. And if you are not living in a very covered environment, if you are always prone to living outside and very much exposed to the outside air, that can also create a lots of problem. So, and because of all these conditions, marginalized communities who are mostly the daily wage laborers and who are belonging to the, what you can say, construction site workers, factory site workers, and any labor community or any of the workers who are street vendors, who are surviving on the daily to daily basis. So they are the more prone and they are the more vulnerable to this situation. Now we'll come to the tapping technology. So it comes to the question that how to care. So we already had discussed that early screening is required, detection is required, awareness is required. So these are the things, and technology play a very important role, because what we have seen that if we have any app which tells your heartbeats, which can tap your, what you can say, pedometer, there is a thing that which can tap that how many kilometers you have walked. So that shows and that gives you a reality check, though it is not medically or accurately correct. Also, there are various technology which can have this mechanism that they can early detect any disease. So we need to use such kind of technologies, and we have to create a community-based solution. It means that primary health care is important, and state level action plan is also important along with the central government. The state government should also think about the health facilities. Then we have scaling community-led system, digital health monitoring, and benefits of screening. So we need to create awareness regarding such kind of things, and we need to visit to the slum area. Then government must ensure that the people who are living into a very dilapidated kind of condition and very miserable condition, so they need to ensure the fresh drinking water. There should be a proper sanitation facility, and also there should be, what you can say, a very good working condition, and environment should be pollution free. So these all things needs to be taken care of. Also early detection is very much important. Suppose that any people from marginalized communities visiting to the government hospitals, and there they need immediate screening for their disease, immediate test for their disease, but they have to wait 10 to 12 days or sometimes for a month for ultrasound, for the blood test. So this creates a very miserable condition for them, and in that situation what we can see that there is an enhancement and advancement in their disease. So we need to cure, and we need to have a early access and very easily access healthcare facilities, especially in the urban areas. So we need to take care of the primary healthcare facilities also. Now we'll come to the question round. The question is, consider the following statement regarding the non-communicable disease in India. India has a national non-communicable surveillance policy aimed at community level screening and preventive care. The implementation of the NCD surveillance policy in urban area is highly effective and streamlined. Rapid urbanization and poor urban planning have contributed to the fragmentation of urban health system. Which of the statement given above is are correct? 1 only, 1 and 3 only, 2 and 3 only, 1, 2 and 3. So you have to answer this into the comment section, and you have to also prepare this topic for your mains, that how we can prevent the non-communicable disease, and how non-communicable diseases are becoming burden on the urban areas, and how many people are affected, what could be the preventive measures, how awareness programs can be spread, how campaigns can be spread, what is the role of state here. So these are the similar questions which we can practice at your home. So that's it for today's session. The link of the Noida branch is available into the comments section. So do find out link and fill the form. If you have any queries, you can call on to the number. And if you have any queries related to this whole particular session, especially the non-communicable disease, you can ask in the comment section. Thank you. Have a nice day.
For more informative content, like, share and subscribe, and do not forget to press the bell icon to get the notifications.